All right, hello, my name is Kevin Hay. I'm a nursing student. I'm a fifth semester nursing student at UTEP, and I wanted to know if I could complete a head-to-toe assessment on you today.
Yes, sir.
Okay, thank you very much. Can I go ahead and get started with your name and your date of birth, please?
Yes, my name is Robert Overgard, and my date of birth is May 10th, 1971.
Okay, thank you, sir. Can you tell me what the date is today?
Today is Saturday, July 18th, in 2020.
And can you tell me where we're at today?
We are in El Paso, Texas, at my home.
Okay, thank you. And can you tell me who the President of the United States today is?
President Donald Trump.
Okay, thank you very much, sir. Client is alert and oriented ×3. Okay, now I would like to start my assessment by assessing the scalp. Here at this point I would have done hand hygiene, but now I will assess the scalp. Okay, thank you, sir. Client has no abnormal masses or pediculosis. Now I will assess the facial lymph nodes. I am assessing the preauricular lymph nodes, and now the post-auricle lymph nodes, now the submandibular lymph nodes, and the submandible lymph nodes. No abnormal masses on the lymph nodes. Okay, now I will assess the fifth and seventh nerve. Okay, sir, can you tell me whether you feel when I press this cotton applicator on you?
Yes, I feel that. Yes. Yes. Yes.
Okay, thank you. Can you tell me if you can you please smile for me? Can you please squint your eyes for me? And can you please close your eyes for me, close your face for me? Okay, thank you. Now you can open your eyes. Seventh cranial nerve and fifth cranial nerve is intact. Now I would like to assess the sinuses of my client. Any pain there?
No.
Sinuses, no pain in the sinuses. Now I would like to assess my client's nose and the first nerve, the first cranial nerve. Okay, can you go ahead and occlude your nose for me, please? One side of your nose. Can you please close it for me, please?
Okay.
Can you tell me what you smell here?
Coffee.
Okay, can you occlude your other nose for me, please? Can you tell me what you smell here?
It smells like sugar.
Number one cranial nerve is intact. Now I would like to assess the eyes and the second cranial nerve. Can you please go ahead and look at my nose for me, please, sir? Corneal light reflex is intact. Pupils are intact. Can you please close your nose for me, please? Your nose for me, please, one more time. Just one. And can you breathe out for me? Okay. Can you do the same thing for the other side? Is there any pain there?
No.
Okay, no pain when breathing. Can you go ahead and stick your tongue out for me, sir? And can you move it around for me? Cranial nerve number 12 is intact. Now I would like to test the peripheral fields of gaze and the cardinal fields of gaze. Can you go ahead and follow my finger for me, please? Okay, thank you. Cardinal fields of gaze and peripheral fields of gaze are intact. Thank you, sir. Can you tell me when? Can you tell me when you see my? Can you tell me when you see my fingers?
I see him. See him. I see him. I see him.
Okay, thank you, sir. Now I would like to test the ears and the auditory the auditory canal. Can you go ahead and okay? Let me put it right here. Is there any pain here, sir?
No.
Is there any pain here, sir?
No pain.
Okay, thank you. Now, can you please cover your ear on this side for me, please? And I'm gonna whisper something, and you tell me what I said.
Football.
Thank you, sir. I'm gonna go ahead and do the same thing on the other side for me, please.
Television.
Thank you, sir. Cranial nerve number 8 is intact. Now I will go ahead and palpate the thyroid gland and the lymph nodes as well. I'm palpating the cervical lymph nodes right now. And can I go ahead and assess your clavicular lymph nodes? I'm assessing the clavicular lymph nodes right now. No enlarging masses. No enlarging thyroid. Once again, no enlarging thyroid. Now I would like to go ahead and hear and palpate the carotid arteries. So I'm going to go ahead and palpate your carotid arteries. Carotid arteries have normal pulse. Now I will assess the carotid arteries for bruits. Can you go ahead and turn your head to that side for me, please? Go ahead and turn it more this way, sir.
Which one?
That way, but go ahead.
Like this?
No, sir, like this, sir.
Oh, okay.
Thank you,
Okay.
sir. Can you go ahead and do the same thing to this side? Tilt your head. No abnormal bruits on the carotid artery. Now I will go ahead and assess the shoulders. I will go ahead, sir, can you please lift, when I tell you, can you please lift your shoulders up for me? Okay, go ahead and, no, I'm sorry, sir, can you please lift them against my, against the resistance on me? Okay, thank you, sir. Shoulders are also intact, no pain there. Is there any pain there, sir?
No pain.
No pain in the shoulders. Now I'm going to go ahead and assess the back of my client. Okay, can I lift up your shirt here, sir?
Yes.
Thank you, sir. Is there any pain there, sir?
No pain.
No pain. Now I am going to go ahead and percuss my client's back. Okay, now I will go ahead and feel for tactile firmitis and see the vibrations of my client's back. Can you go ahead and whenever I move my hands along your back, go ahead and say the word 99 for me.
Okay. 99.
I'll hold on to it. Okay, go ahead.
99. 99. 99. 99. 99.
Okay, thank you, sir. Tactile firmitis is intact. Actually, I'm going to assess for lung sounds. I will start in the posterior side of the lungs. Yes, sir. Okay, breathe in and breathe out for me, sir. Breathe in, breathe out. Breathe in, breathe out. Okay, thank you, sir. Resonance of the lungs is normal. And now I will assess the interior side of the lungs. I'm going to have to go inside your shirt one more time, sir. Through the front. Breathe in, breathe out. Going to the lower portion, sir. Okay, thank you very much, sir. I appreciate that. Now I will go ahead and assess for the heart sounds, starting with the atrial. I'm at the first intercostal space of the right sternal border. Now I will assess the second intercostal, the left sternal border, which is the pulmonic valve. Now I will assess the Erb's point at the third intercostal space, which is in the left sternal border. Now I will assess the fourth intercostal space at the left sternal border, which is the mitral, which is the tricuspid valve. Now I will go ahead and assess the apex, which is at the mid-clavicular, at the fifth intercostal line. Oh, sorry, sir. Okay, thank you, sir. There was no abnormal heart sounds, no no. There was regular S1 and S2 sounds. No heart murmurs. Okay, now I will go ahead and assess my client's abdomen. Can you go ahead and lie back for me, sir? I'm gonna go ahead and auscultate my client's abdomen to start from the lower left, from the lower right side quadrant. Now I will move up to the upper right side of the quadrant, and I move to the left side of the upper quadrant. And now I'll move to the lower side of my left lower quadrant of the client. Client has normal bowel sounds. I will now percuss the abdomen of my client for the liver size. Now the spleen. And now I will palpate my client. Let me know if you have any pain, sir.
No pain. No pain. No pain. No pain. No pain.
Client has no pain on the abdomen. Now I'm going to assess my client's arm strength, and if you could sit up for me, sir, and you can put your shirt down again. Now I'm going to assess my client's arm strength and the shoulders as well. Can you lend me your hand, sir? Thank you. Any pain here?
No pain.
Any pain on the wrist?
None.
Any pain here on your wrist,
No
sir?
pain.
Can you go ahead and twist your hands for me this way? Can you grab my hands this way, please? Can you squeeze my hand? Thank you. Now I'm going to go ahead and test for capillary refill, sir. Client has normal capillary refill within less than 3 seconds. Now I'm going to go ahead and view the pulse of my client, the radial and the brachial pulse on both arms. Client has a normal pulse on the right hand side for the brachial and radial of a 2+. Can I go ahead and take your watch off, sir?
Yes.
Thank you. Client has normal radial pulse and brachial pulse on the left side with 2+. Now, can you go ahead and make a muscle for me? Can you go like that? Thank you. Now, can you push against my hands? Thank you. Can you push against my hands that way? Thank you, sir. Now I'm going to hand and arm strength are within normal limits. Now can you go ahead, I'm going to go ahead and test my client's knees and his legs. to see this to test the strengths and then the pulses. Can you go ahead and move your knee against my hand, sir? Thank you. Can you go ahead and do the same thing? Thank you. Knees are intact. Can you go ahead and push against my, can you go ahead and put your feet together for me? Can you go ahead and push your legs to the side for me, please? Okay, thank you. Now can you go ahead and push them inward for me? Thank you. Can you go ahead and push your legs against my hands for me, please? Thank you. And can you put your feet up a little bit more? And can you move your legs towards my hands? Thank you. Legs are leg strength is normal. Now I will test the mobility of the ankle and the pulses on my client's foot. So can you go ahead and lift your leg up for me, sir? And can you move, invert your foot this way for me, please?
Yes.
Yes, sir.
Okay.
And then this way for me, please. Thank you. Any pain there?
No pain.
No pain. Same thing here. Can you go that way? Now this way. Thank you, sir. No pain there?
No pain.
Okay, thank you. Now I'm going to go ahead and ask you to take off your flip-flops for me so that way I can test the pulses. I'm going to go ahead and test the dorsalis pedis pulse on my client on the right side. Can I go ahead and do the same thing for the left side?
Yes.
Thank you. Now we'll test normal pulses for both dorsalis pedis on the right and left. Now we'll test the posterior tibial pulses on both sides. Posterior tibial pulses are normal within 2+. Okay, thank you. Now I would like to continue my head to toe assessment with my musculoskeletal system. If I could have the patient stand up for me, please. Thank you, sir. Can you turn this way for me, sir? Now I'm going to ask you if you can lift your hands all the way up for me. And can you lift them back down for me? Thank you. And then can you lift them back for me? Thank you. Can you lift them back to your sides for me? Go ahead and lift to the sides. Now go ahead and forward. Thank you. You can go ahead and put them down for me. Now I'm going to test my client's range of motion on the neck. Let me just put this up a bit. Can you go ahead and tilt your head to the side for me? Thank you. Now to the other side. Thank you. Now can you turn your head to the side for me that way? Thank you. Now turn this way for me. Thank you. Now can you lift your head up for me? And then can you lift your head down for me? Any pain there?
No.
No pain there. Okay, now if I could ask you to stand right here for me. And if I could ask you to turn around for me. Thank you, sir. Now I'm going to assess my client's spinal cord. If you could bend over for me, sir. Thank you, sir. I'm going to lift your shirt up one more time. Any pain there, sir?
No pain.
Any pain while bending over?
No.
Spinal column, no spinal column deviation. No pain. Now can you go ahead and stand right there where you were for me, sir? Right here, facing that way. Can you walk towards the door for me? And can you walk back towards me? Okay, thank you, sir. Ambulatory gait and ambulatory is good, and gait is in control. Thank you, sir, for your time. I appreciate you for letting me do the head to toe assessment on you. If you have any other questions, let me know. Okay, thank
No
you.
questions. Thank you.